Hi, I'm Dr. Janet Pope. I'm reporting here at Room Now on our ACR 20 virtual or convergence conference. I have invited some trainees, some PGY 4-5 trainees, to talk to me about what it's like going to virtual conferences and learning, and also a little bit about what it's like in their program, because we are such a specialty that we really have always valued the physical exam. So Arpita, can you tell me who you are and what year you're in?
Hi, I'm a fifth year rheumatology fellow at Western University in London, Ontario. And yeah,
Great, wonderful. Gabe, can you tell me about you, who you are and what you're doing?
Absolutely. So my name is Gabriel Jeyasingham. I'm one of the PGY4s also here at Western University in London, Ontario.
Great. Gemma, what are you up to?
Hi, I'm Gemma. I'm PGY4 in Rheumatology in Toronto, Ontario.
Great. And Melissa?
Hi, I'm Melissa Holdren. I'm a PGY4 in Rheumatology at Western Ontario.
Great. So thank you for joining us here at Room Now. So my first question is pretty general, but how has it been where you're not seeing too many people in clinic? Do you feel you're getting a valuable training experience?
So I can start. I'm in Toronto and I've been going through different hospital sites. So every site does it a little differently. But I would say I'm seeing 90% of patients virtually, whether that be through Zoom, through Ontario's own kind of telemedicine module system, or kind of through telephone. So it has been a big shift kind of in terms of not getting access to the physical exam. I would say on average in a week, I'm seeing between 1 and 4 patients actually in person. So it is a little bit daunting and scary in terms of losing those joint skills, but I think we're making the best of it. I think we're getting better and better at trying to show patients how they can show us their joints on Zoom or whatever we're using, or kind of getting them to kind of do their own measurements, like for AS with the Schober's test. So where I think patients are learning a little bit more about their disease by us trying to get them to do things over Zoom, but it's definitely been tough as PGY4 just starting rheumatology.
Right. And at Western, I know Toronto has had more cases, of course, per capita than us in London, Ontario. So anyone from London, can you sort of give us the case mix that you're seeing?
So I can chime in. So I'd say we're about 50-50, like 50% in person and 50% virtual. It definitely is different doing virtual care. I think I'm getting a bit better at asking kind of specific ways to figure out exactly what joint a patient is talking about in their hands, to figure out, are they complaining more of OA pain versus their rheumatoid arthritis? And then sometimes we're finding we just have to bring patients in anyways, because you can't get a good enough history over the phone to tell, are they really having a flare or is this just pain?
So I have a question. Have you all been able to bring a patient in if they're flaring, or there's been too many restrictions?
I can speak to that. I think I've personally, when I feel that someone may be flaring or it's hard to determine what's going on, I think in most cases we have been able to bring people in, usually within the next few weeks. So I haven't found that too much of a problem so far.
Right, great. And what I can say is, so Dr. Cush has done actually a lovely video on getting patients to do range of motion and following him if you're doing video. I know in London we do a lot of phone calls. They're almost in a way solely phone calls. I know in Toronto you've had a mix. So he has that. There's also a neat abstract, including the catch cohort as well as the catch US side, combining to say, comparing patient-reported CDI, where they're doing their own counts, and CDI when we see the patient and done on the same day. And it's quite telling that in general, if they say they're in low disease activity, high concordance, pretty good agreement. And if they say they're in high disease activity, the patient, sometimes it's concordant, sometimes it isn't. So that's where, when you're uncertain, you bring the patients in. So I'd like to shift gears now, and because now many of you have had your you've written your exams. It's they were delayed. You've had maybe even virtual OSCE, so physical exams virtually, and you've done other meetings such as some of the meetings for education and grand rounds virtually. So does anyone want to talk about the pros of having the virtual learning? And then we'll talk about maybe some of the downsides.
I think a pro, at least in Toronto, is that we have many different sites. So a lot more people are able to attend our rheumatology rounds and journal clubs because they're not rushing to clinic at a different center. So that's been one good thing in terms of turnout has increased. And I guess at the same time, kind of it's been difficult in that you're not necessarily seeing people as much in person. So I feel like there's definitely kind of less interaction in these rounds than there would be because it's a little bit kind of more challenging sometimes to ask a question over Zoom.
Right, absolutely. That interactivity is sometimes lost. Anyone from Western have that kind of perspective and or other perspectives?
Yeah, I agree. The interaction, it's sometimes difficult to keep that up because even if you do ask a question, sometimes it's lost in translation. But it has been very helpful in terms of being able to record lectures and slides that are helpful. It's easier to screenshot them, keep them for future and learning. So that way, I feel like it's been very helpful.
I think one thing too that I can say is we can have more international speakers because they can do it from the comfort of their own clinic or their home. And also I would say, if anything, we seem to have more nighttime CME because I guess in a way it's just an hour of your time or an hour and a half instead of a whole evening. And sometimes I think it's overwhelming how much CME we get. I think that you're going to learn at this virtual meeting that you have to, just like in person, be organized. I think that you can rewatch the lectures, you can look at more posters. So I think they're the plus side. The downside is I think the FIT program of the ACR allows a lot of people to be together and learn and meet other people from US, Canada, and also obviously while you're having the week elsewhere. So I think that interactivity is kind of lost. However, I do think that with good discipline, you can learn an awful lot and you can go back and refresh and look at things again, which we could do when things were taped, and frankly, I never did when it was in real time. I never went back and looked. Any other comments from the group?
I think it's nice that we can kind of attend any session we want to, because I remember going to other conferences kind of before I knew what I was doing. I didn't realize I had to sign up for certain things ahead of time and maybe the room would be full or you couldn't quite make it from one room to another in time. So it's kind of nice that you can pick anything you'd like to and everyone can attend.
That's right. So both, either whether it's live and a lot of things are taped and then there might be adequate time for discussion. They also have some neat tips that you can look on some of these encore things or meeting the expert and some of the symposium you can certainly look at in real time or later as well. Well, with everything, I'd like to thank you and thank you for coming on to Room Now, and I hope you have a wonderful ACR 2020 convergence. Thank you.